Okay, welcome back. Can you hear me? Last stretch. Okay. Medical abbreviations, week 5. If you notice, our list of 10 medical abbreviations this week has something to do with compounding. It is always something that our list is always connected to the 4 classes that you have for that particular sequence. Okay, a couple of things. Like suspension, abbreviation for suspension. I want to say if you need it capitalized or not. Raimi, what's the abbreviation for suspension?
Capital S, USP, and then a period.
Okay, you don't have to capitalize the S though, okay? You can see in prescriptions that it's just SUSP, period, okay? But for you to be on the safe side, whatever is on your packet for test purposes, that's what you want to put, okay? Because whoever encoded the test, be it me, Miss Janice in the past, or Miss Trisha, if you fight it, then you have a paper showing that, well, the handout says this. But in reality, know that suspension is abbreviated as SUSP, period. You don't have to capitalize the first S. Clear? Okay. Ointment, you're probably thinking, that's so weird. The abbreviation of ointment is UNG because it came from the word unguentum. Remember, our medical terminologies came from Latin or Greek words, okay? Unguentum, UNG, okay? Now I'm seeing ointment abbreviated as OINT, period. But in the past, it's just UNG, okay? Came from the word unguentum. Does it have to be capitalized? No. Okay, they don't have to be capitalized. It can be lowercase UNG. Okay, is that clear? Okay. Next one, coal tar solution, LCD. Okay, LCD. Who knows what LCD stands for? What LCD stand for? The C is carbonis. Anyone?
It's in math.
That's good. Okay, least common denominator.
There you go.
Yeah, but this isn't math. So what do you think LCD is? Coal tar solution. What words? Coal tar solution, because it's hard to remember now. Why is it LCD? Just like ointment is UNG. Anyone? Anyone? Coal tar solution. It's actually Lisbon carbonis distillata. Okay. Yeah, it's hard to remember. I'm just telling it to you so that you know that, oh, that's why that abbreviation. Okay. Just like right eye, OD. Oh my God, how did right eye become OD? Because I is oculo, D stands for the right side, which is dexter. Okay. So LCD, coal tar solution. You don't have to remember the Latin or the Greek words. Okay. Dilute. What's dilute, Nicole?
Capital DIL.
Okay. In real life, we don't have to capitalize the D. It's just DIL, period. Okay. It can mean dilute or diluted. Okay. What does dilute mean? Since you've been going to the campus learning about reconstitution, learning about sterile and non-sterile compounding, Kevin, what does dilute mean? I talked about this on the first lecture, Introduction to Compounding.
Diluting is basically to make a liquid like thinner or like more easily mixable like by using another like solvent into it to mix it.
Okay, good, good. Okay, you have to remember when you say the word dilute, it's making a higher concentration into a lower concentration, a higher strength into a lower strength. Remember your allegation? Okay, what did I explain? A coffee is too strong. What do we put? We add, don't say creamer, please. We add water.
Water.
Okay, we add water. Same as when we were talking about dilution and allegation last sequence, we reduce the strength of the drug from a 60% to say, for example, a 30%. So your powder drugs in the vial, which you've been handling this last couple of times you were at the campus, are concentrated drugs, okay? It can be a specific percentage, but that's going to be concentrated. And if you add water, then you make it less concentrated or less strong. That process is called dilution, okay? So on top of that, we have the diluent. Okay, what is the diluent? Diluent is the substance that dissolves it. Okay, diluent is the substance that dissolves the powder. Okay, next one would be compound. Brandon, abbreviation for compound.
Capital C, lowercase o, and p.
Okay, that's what's on your packet. However, real life, you may see COMP period or COMP. Okay, so compound. Okay, you will see that. They don't have to be capitalized as well. Okay, the first letter C. Divide, Lawrence, divide.
Lowercase d-i-v.
Very good, lowercase d-i-v. At Ziri, what's suppository?
Capital S-U-P-P period.
Correct, okay, but in practice, it can be all lowercase, S-U-P-P period. Okay, what is a suppository, Tony?
It is medication that you take through the rectum.
Okay, a suppository is a drug or a medication or a substance that's meant to be inserted into a cavity. Not only the rectum, usually the rectum, but it can be the vaginal cavity. Okay, let me ask you this. Who knows what a suppository is before they started the program? No one? Do you know what a suppository is? Okay, Tony said, yeah, okay. What's the verb that we should use when we're writing the SIG, when we're dealing with suppositories? Seniors, you should know this. Kevin.
Unwrap and insert.
Very good. Usually they're in a foil, so you want to make sure that they unwrap first before they insert. You don't want to have complaints from patients saying they have rectal bleeding and you're wondering why, because they inserted the whole thing with a foil. Sounds funny, but it happens. That's why we want to make it clear on the SIG, unwrap, then insert, and then tell them where to insert, okay? Tincture, abbreviated as, Jess, can you hear me? I think she can. Okay. Tincture is abbreviated as TR. Can be capital T, lowercase r period, or TR, lowercase period. Okay. And then the last one, Ziri mix.
M-I period.
MI period. Usually in real life, we don't just drop that last letter. We just put mix, right? Why would you even drop that last letter? But for test purposes, make sure you follow the ones on your handbook. But in real life, we just put MIX, mix, or prepare, okay? Again, schedule. I'm holding my planner right now. Schedule for tomorrow will be access OPETs for drug words and abbreviation tests. at 7 a.m. Okay, closes on Wednesday, so I will extend. Okay, closes on Wednesday at noon. However, I and Ms. Tricia will see you at the campus tomorrow at 9 till noon. This is mandatory. It's not optional. Okay, I don't want to put an F or an incomplete on your PHA 225 final grades. Okay, why is that? Because on Wednesday is the official start of our last week for PHA 225 and 135. So you want to put on top of the other things I'm telling you, final exam for PHA 225, pharmacy lab skills and pharmacy math 135 is on Tuesday, the 22nd. Okay, it's always a Tuesday because we start a new class on Wednesday, which means we start sequence 4. Now, we go live on Thursday. We don't go live on Wednesday. We go live on Thursday for math 2 hours. Straight 2 hours to make up for what we missed today. Okay, what are your homeworks for math before I let you go? Brandon, you remember where you left off with Ms. Trisha? She told me, but I want to make sure that you guys know. What needs to be submitted for math? Now is it time to check if you're missing anything?
Was it our quantity to be dispensed? Oh no, that was due today, right?
Yeah, Nicole, you sent me an email about this homework. You remember? I saw that last night. So what was due?
I sent you an email, but I didn't add my quiz.
Oh, your quiz. Okay, but
Yeah.
what is due? So day supply, quantity
Quantity
to be dispensed, homework. Okay. Did you guys go over that already? Or is it just a homework? You haven't gone over it? Because when we go live on Thursday, I want to start off with flow rate and drip rate. Okay. It's going to be flow rate and drip rate. So homework for math, make sure you watch the videos I had in there on your course content on Blackboard on flow rate and drip rate. I presented different ways on how to calculate flow rate and drip rate. Miss L, is flow rate the same as drip rate? I'd say yes. Okay. The major topic is flow rate. Okay. Or you will see some books say drip rate. How is it different? Flow, think about it. Do you think flow is larger than a drip? Yes. That's how I think about it. So your flow would be ml per hour and your drip will be drops per minute. That's just the difference. Can you convert ml to drops? Yes. Can you convert your hour to minutes? Yes. So flow rate, drip rate is going to be our topic on Thursday. Is that clear? Miss L, why do we have to study flow rate and drip rate? It's not our job to calculate this. It's the nurse's job because you have to. You're going to be tested on this, even in the PTCE. Okay. I had our ABHES specialist, accreditor, when he visited us for the audit, he said that while he was admitted into the hospital, he actually calculated his own drip rate for his IV bags and helped the nurses do it because they, at that time, they couldn't figure out. So he said, let me help you do it. Okay. So yeah, this will be part of any major exam, the flow rate and the drip rate. You may use it, okay, eventually, depending on the setting you're in. Okay, Ms. Jaylene, can you think of settings where they can use the flow rate and the drip rate topic as a pharmacy technician?
Oh yeah, for sure. Like in the IV room, or the hospital pharmacy. Yeah, you'll definitely see those on your the patient's labels. It's something that nurses kind of take care of, but it's really beneficial for us to know what the label says. So it's very useful in the hospital for sure.
Yeah, that's correct. So it's usually the nurses that take care of that, but pharmacists check that label too. okay, for the flow rate. Double check to make sure that it's the correct flow rate or drip rate that they're administering. Okay, so any questions? I'll see you guys tomorrow at the campus at 9. Don't be late. 9, you should be in the classroom. Yes, Lawrence, I will stay with you.